Medical device alpha test process is really part of the Golden Jubilee's innovation agenda, and it's become quite, I think, a central part to it. And what we found is that the larger companies that we work with have got facilities for getting consultants involved in reviewing their devices. But the smaller companies that we talked to really didn't have that ability. What we decided to do is to put together a process that was essentially a panel review of their device or of their concept. And that is quite unique to the device industry, where the tendency is to find a key opinion leader in the field and to ask them, how do you think this device should be developed? So to have a field of 3 experts, or 4 sometimes, giving that view as a panel to a chair who then makes a decision on the outcome is a much more rounded way of doing it. We were very clear about intellectual property, and the important thing about that is that in the development of devices, the ownership of intellectual property determines really who owns the device itself. We're quite clear that during the process, any intellectual property will belong to the company and not to the person from whom the idea originates. At the beginning of each event, I'll present a number of slides. The company will then present their concept or their device, but what we like to do is encourage the presenters to bring the device itself so people can look at it, touch it, feel it, see what it looks like, whether it would fit in with other devices that the healthcare professionals might be using at the same time. The panel will then basically ask all of the questions that they need to get it clear in their mind how the device or the concept will be used in their environment. I'll open the discussion to the audience, who can then input any ideas or any suggestions that they might have. Then the event closes and the panel will retire to consider its opinion. So there are 3 possibilities for an opinion. The first is that nothing further will happen. The panel doesn't think that there's mileage for the device or for the concept within the NHS. The second option is that the device has been shown to work within the environment that the presenters are discussing and that the panel have discussed. But there might be a case where our colleagues, healthcare professionals, would like to evaluate it within that environment in order to look at the user ability of the device in question. The third option is that the panel, like the device, think it might have some mileage in Scotland, but there isn't enough evidence out there for them to use it or to evaluate it. And at this point in time, we would go into the research mode. So the company would come back to us and we would advise them how to take it forward in terms of a research project. And because we routinely run service evaluations and we run lots of device research projects, we can quite ably advise the company in that way. Critical to all of this is the report. Essentially it has the bones of the discussion and most importantly the outcomes, what the panel have decided that the device is to them, what it means to them and what they think the outcomes are. And that kind of represents the end of the MDAT process.